I'm Dr. Brett Gilbert, board certified endodontist, and I've been doing endo for over 20 years, and I love getting out and exploring what's new in the marketplace, and I wanted to bring that information to you. So let's get busy discovering together and explore what new products are out there. In this episode, we're going to review products from VISTA-APEX. And these products are very interesting to me, and I really wanted to share them. They relate to both irrigation, but also to hemostatic agents, something that we all sometimes need in endodontics. So first, we're going to talk about the EndoUltra. This is an ultrasonic activation unit, and we're going to discuss how it's used, but this is a standalone unit for ultrasonic activation. Now, proprietary solutions such as Chlor Extra and Smear Off are really the modern day answer for irrigation solutions. Unfortunately, using store-bought household type solutions are no longer the most effective option, and oftentimes leave a lot of question marks about whether or not you're getting the full impact of the solutions you're using. So we'll talk about how these solutions work together. The next product is the micro evacuation set. This is really interesting. This is going to be a high-speed suction tube attached to a very small evacuation tip. I find this to be a time saver, and in some emergency situations can be an incredible way to decompress. And then lastly, the Quick Stat Free, which is an aluminum-based clear hemostatic agent. So these products have been very interesting to me. I've been using them in my practice, and I'm really excited to share them with you. The first product we're going to discuss is the EndoUltra Ultrasonic Activation Unit. Now, what's unique about this is that it is its own device for ultrasonic activation. Now, it comes with a number of different parts. It comes with several tips to use inside, that these are going to be reusable and autoclavable. It comes with a tightening wrench, which can also be used to bend the tips. It also comes with plastic barriers to make sure that we're keeping things as hygienic as possible. So what this is used for is to actually stimulate or activate the solution inside the chamber in the canals. Endodontists and the research will tell you that activation of our irrigation solutions is critical. And the purpose of that is that you want to be able to increase the activity of the solutions on tissue, biofilm, smear layer, etc. So using ultrasonic activation, which actually forms cavitation clouds, is going to be the motion or the mechanism of implosion of liquid molecules. So this device will allow you to create the level of activation where cavitation can help to penetrate the solutions into the dental tubules, help remove and dissolve more tissue, and really be much more effective with your time in regards to endodontic irrigation. So you simply touch the button, the tip activates, and when you go into the solution, you see this action. So what I want to be clear about is that some other devices such as ultrasonic units have the ability to use tips that allow you to do ultrasonic activation. What's nice about the EndoUltra is you don't need to have an ultrasonic unit specifically for this. This device by itself can allow you to do very effective ultrasonic activation of the solutions, allowing greater efficiency as well as greater effectiveness of your treatments. So this is the EndoUltra Ultrasonic Activation Unit. The next products I want to discuss are the irrigation solutions themselves. So these are proprietary FDA-approved solutions that come in a bottle just like this that has an expiration date and a lot of reassurance that you have the highest power, most effective solutions that you're using inside the canals. Let's face it, the chemical preparation of the root canal system is really where the work is done. We need these solutions to dissolve tissue, to kill bacteria, to break up biofilm, and ultimately remove the smear layer. So the inorganic and the organic debris have to be removed with the irrigation solutions. So the first is Chlor Extra. So Chlor Extra is going to be 6% sodium hypochlorite with different modifiers and surfactants. Why surfactant? You know, we've seen this great evolution in endodontic irrigation where surfactants, which lower the surface tension of sodium hypochlorite, allow for much greater wettability, surface area coverage, and ultimately penetration of the solutions into the dental tubules. So Chlor Extra is an opportunity for a doctor to put the solution in the tooth and know that it's working properly. Free available chlorine is really the key element to being an effective irrigation solution for antimicrobial activity. And when you use a proprietary branded type of solution like this, you have an expiration date, you have controls for how it's produced, how it's stored, how it's shipped, and this gives you a great moment where as a doctor, you know that when you're using this in your patient treatment, you're getting the most effective solutions. it's very, very clear that household type bleach and household solutions simply don't have those same controls. They don't have expiration dates. And ultimately, they're so sensitive to the environment that you could be using a solution that really is quite ineffective and not be aware of it. So I feel that the investment in a proprietary solution like ChlorExtra is critical to excellent endodontic care. Now on the flip side of that is going to be your 2-in-1 smear off. So this is going to have both EDTA, chlorhexidine, as well as again more of these surface modifiers or surfactants. So this again is going to give you an opportunity to really get rid of the inorganic debris. So that's going to be your dentin chips, your smear layer, etc. The nice thing is we all were made aware in school that you really shouldn't mix solutions together. But these can be mixed together without any rinsing in between. And that's another tribute to their stabilizers and the ability that these are solutions that are very well controlled and chemically put together to work in conjunction for the best possible cleaning inside the canals. So again, sodium hypochlorite with surface modifiers and surfactants. This is EDTA, chlorhexidine, again with surface modifiers and surfactants. And working together, you are able to really effectively remove both the organic and inorganic debris inside the root canal system. So proprietary branded solutions, that's the way to go in my opinion. These are products that I've used in my practice for a long time, and I feel that they really do a very nice job of giving you that cleanliness that you need inside. The next product is the Micro Aspiration Evac Set, and this pairs up with the ELASTIVAC tips. So what's really cool about this is there are sometimes products that you discover that simply save you time. And for me, this is one of them. So you have this little evac tip, the ELASTIVAC tip, that goes right on here with a little lure lock connection. And this tube then goes into your high-speed suction. So now when I'm finished with my irrigation protocol, I'm simply going to go in with this tip and just suction out all the residual solutions that are in the canals. It allows me to only use just a paper point or two that allows me to move into the obturation phase much quicker. Now I'm going to give you another indication for this that I find extremely helpful. When you're in a situation where you have drainage through the tooth, so the patient has purulence coming up through the canal, this microaspiration evac set is an incredible way to just decompress that lesion, suction out the purulence, the bleeding, and really get yourself in a position to move forward through the procedure much more efficiently. So I use this in every case. I find it incredibly helpful as a time saver. It saves the effort of you and your assistant passing paper points and ultimately gets things dry very, very quickly. The next product we're going to talk about is the QuickStat Clear Hemostatic Agent that's used with the StatFlow tips. So what's really unique about this is the clear nature of it. Now, QuickStat Free is the first clear hemostatic agent that has a more shortened hemostasis time. Historically, most of the hemostatic agents are based on ferric sulfate, and ultimately they provide some staining that can be very much unappreciated in aesthetic zones. As an endodontist doing endodontics and dealing with deep decay, we're constantly managing hemostasis when we want to place a restoration or isolate and create a barrier for the pulp chamber and the canals. So the QuickStat Free is a great opportunity to very quickly apply the solution, to be able to keep it in place with its gel and then rinse it to get really nice hemostatic effects. So QuickStat's astringent hybrid technology is made with both aluminum and with magnesium chloride. It also has a powerful surfactant in it that allows you to penetrate into the capillaries, allowing for 20% faster onset. It's got an ideal gel consistency that this tip, the StatFlow tip, which has just a little brush end on it, allows you to place it very precisely, and the gel consistency holds there until you rinse it, getting the effect. So as an endodontist, I'm using this regularly to keep my sites clean, to be able to control bleeding, and ultimately the QuickStat Free is a great option for anyone looking for a hemostatic agent that's not going to stain and clump like the classic ferric-based ones do. All right, so let's take a look at the EndoUltra in the clinical simulation setting. So let's bring this into a more simulated canal, and we're going to bring it in, and when we activate, you'll see the bubbling happening, and you can bring this in and out of the canal. And you can see the ultrasonic activation creates a cavitation cloud that allows better penetration of the solutions. Bring it in here. And again, you just bring it in an up and down motion, and it gives activation to the solutions. Let's take a look and see how it acts in solution with a little dye. So right at the tip where it's most active, you can see the bubbling effect. into the solution, creating little micro bubbles, and this is going to be the cavitation that we described. Again, ultrasonic activated irrigation, it's an in and out motion, and this is the EndoUltra unit. Okay, so let's take a look at the micro aspiration evacuation set. Again, we have the little tip here, and this is going to attach right in via lure lock. So again, you can see how it attaches here. And then what I'm going to do when I'm finished with my irrigation protocol is I'm simply going to just introduce it into the canal, and very, very quickly and effectively I'm going to be able to suction out all the excess solution, and then with just a paper point or two, I'm dry and I can get going with my obturation. Again, if there was a purulent situation in drainage, this is a wonderful way to decompress the infection, allowing to suction in all the pus and blood. In this live video, you can see clinically how it can actually suction and aspirate the purulence from the inside of a tooth. When you have intracanal drainage, decompressing that quickly and effectively will help your patients feel better and will also allow your treatment to move on and become much more efficient. Okay, let's take a look at the QuickStat Free, the clear hemostatic agent, clinically in just a simulation. I just want to really show you the consistency of it and how it applies. So it pulls through, and you'll see that it's sort of a gel formation, and you can use the brush, and because it's gel, it very much holds onto the tissue. And if you were doing a prep, if you were doing endo prior to a prep, if you had a bleed and you wanted to place a barrier, you just leave this in place, you sort of brush it, kind of get it into the solution, remembering it has those surfactants which get into the capillaries. And what this allows you to do is just get this material in, start the hemostatic process, and then ultimately rinse it with air and water. So this is going to be your QuickStat Free. Just wanted to show you the gel quality of it, the easy handling, and the ability to use this to get 20% faster hemostasis than any of the other clear hemostatic agents. So again, no clumping from a ferric type inclusion in the other materials that we've seen for hemostatic agents. So it's clear, it's clean, and it's a really nice product to use for hemostasis. I hope you've enjoyed learning more about the products from VISTA-APEX. In this episode, we covered the EndoUltra, a handheld ultrasonic activation unit for improved irrigation in the canals. We also covered the microaspiration evacuation set with the ELASTIVAC tips for really quick and easy removal of solutions from the chamber and easy decompression when you have intracanal drainage inside of a tooth. We also talked about QuickStat Free. This is a clear hemostatic agent that's based in aluminum for great hemostatic effect. And lastly, we covered the proprietary irrigation solutions, Chlor Extra, 6% sodium hypochlorite with surfactant, and the Smear Off, which is a 2-in-1 EDTA and chlorhexidine mix, also with surfactants. Better penetration, more reliable cleaning with these solutions versus household solutions. I give these products my seal of approval, meaning that I have vetted them, I have used them in my own clinical practice, and I think they're a great option for any dentist that's doing root canal treatment. So I hope you enjoyed this video. If so, please like it and subscribe to my channel. Also, leave any comments or questions below. I would love to hear from you. I would love to interact with you. And if you have any products that you'd like me to review, please let me know. Leave a comment and I'll get back to you. So thank you for watching the video and have an awesome day.